Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about the Dexa scan, the gold standard for bone and body health. Dexa scans for dual energy X-ray absorptiometry. It is used to screen for osteoporosis, which is a condition characterized by a low bone mass and microarchitectural deterioration leading to bone fragility and increased risk of fracture. Dexa's role is to detect osteoporosis and its precursor, osteopenia, often long before a fracture occurs. It is also used to monitor the effectiveness of treatments such as medications and exercise over time. The diagnosis of osteoporosis is made based on the lowest T-score reading across the major sites, the spine and the hip, because osteoporosis anywhere means osteoporosis everywhere. Beyond bone, analyzing body composition, Dexa uses low-dose X-rays to distinguish between the three major tissue types, providing precise measurements. Bone mineral content, the actual mass, weight of bone mineral. Fat mass, the total weight of fat tissue in kilograms. Fat-free mass, lean mass, includes all muscle, organs, skin, water, and bone, primarily used to track muscle gain or loss. It identifies visceral adipose tissue, the dangerous fat stored around abdominal organs such as the liver, which is highly correlated with cardiovascular and metabolic disease risk. Who should get a Dexa scan? The decision to get a Dexa scan is typically based on age and clinical risk factors. Postmenopausal women, recommended for women over age 65 due to the highest risk demographic for osteoporotic fracture. For men, recommended for men over age 70 due to increased age-related bone loss risk. Individuals with risk factors at all ages, if you have a family history, early menopause, long-term steroid use, rheumatoid arthritis, low body weight, or a previous fragility fracture. And patients in treatment at any age to monitor changes and the effectiveness of osteoporosis therapy. The procedure, quick, painless, and low dose. You will lie comfortably on a padded table. A mechanical arm passes slowly over your body, emitting a low-dose X-ray. The scanner measures how much energy is absorbed by your bone and soft tissues. Denser tissue absorbs more radiation. The entire process usually takes 15 minutes and is entirely non-invasive and painless. Decoding the results, the T-score, interpreting bone density. Bone density results for postmenopausal women and men over 50 are standardized using the T-score. This score compares your bone density to that of a healthy young adult at peak bone mass. Normal. T-score is minus 1.0 and above. The bone density is within the typical range. Osteopenia. The T-score is between minus 1.0 to minus 2.5. Low bone mass, increased risk of fracture. Osteoporosis. T-score is minus 2.5 and below. High risk of fracture, a clinical diagnosis requiring intervention. Body composition norms, muscle and fat. Normal values vary by age, sex, and ethnicity, but these key indices assess metabolic health. Body fat percentage. For men, the healthy range is 6 to 24%. Women, 14 to 31%. Higher values correlate with chronic disease risks. Lean mass index. For men, the healthy range is greater than 7 kilograms per meter squared. For women, greater than 5.5 kilograms per meter squared. A low lean mass index is used to assess the risk of sarcopenia, which is age-related muscle loss. Summary of benefits. Why Dexa is the gold standard. High accuracy, widely considered the most accurate tool for both bone density and total body composition analysis. It identifies low body density osteopenia before a debilitating fracture occurs, allowing for preventative treatment. It allows for precise monitoring of how lifestyle interventions, such as diet and resistance training, affect muscle and bone composition, providing objective feedback. It is non-invasive, painless, and uses extremely low levels of radiation. Limitations and next steps. Bone quality. Dexa measures density, which is quantity, but cannot detect bone quality. Accuracy may be less accurate in individuals with spinal conditions, severe obesity, or metal implants. Next step, talk to your doctor. However, you can get a DEXA scan without an order. A single DEXA scan is a snapshot. Its true power lies in using repeat scans to track meaningful changes in your bone and muscle health over years. Well, thanks for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.